The bubonic plague has claimed 20 lives in Madagascar. This is very concerning, Lewis. The BBC is reporting that a village in Madagascar has been hit by a deadly outbreak of the bubonic plague, and medical experts on the island are confirming that the death count is 20 and possibly higher. The International Committee of the Red Cross is warning people from heading there now, and in October, we're already warning that Madagascar was at risk of a plague epidemic. The bubonic plague is transmitted to humans via fleas, usually coming from rats initially. So the fleas kind of transmitting it from rats to humans. It's also the same disease that used to be known as the Black Death, Lewis, where it killed 25 million people in Europe during the Middle Ages. It is very rare now. Last year, Madagascar did have 60 deaths from the plague, which is the world's highest number. A lot of these are being kind of blamed on or traced to the horrible prison conditions in Madagascar, where there are rats all over the place, incredibly cramped, horrible conditions, and that seems to be the source of some of these outbreaks. A lot of people, Lewis, didn't even think bubonic plague was a thing anymore.
Yeah, it's kind of scary to think about that it is still around, but luckily, it's usually in areas or countries like this, and it's usually contained, and we know how to handle it now. But it's when you know that it killed 25 million people at one point, you can't help but worry about it a little bit.
Absolutely. And as far as treatment goes, people who are infected with the plague need immediate treatment. They should be given antibiotics within 24 hours, Lewis, to prevent death. There are other treatments as well. People who have had contact with anyone infected by the plague are given antibiotics, and this has been significantly effective in reducing the number of deaths. The first recorded epidemic was back in the Byzantine Empire during the 6th century and was named the Plague of Justinian, after Emperor Justinian I, who was actually infected but was able to survive through extensive treatment back in the 6th century. This is not something that you really want to mess with if you can avoid it.
Yeah, this is definitely something to avoid, and I just hope that the antibiotics continue to work.
Right. Yeah. That's a broader conversation, which we've kind of alluded to a little bit, Lewis, which is the broader concern about the decreased effectiveness of antibiotics. And even though many people may assume that, hey, there are always new antibiotics, it's true, but they all are part of one of three types of antibiotics. And typically these are thought of in groups. So even though there are a lot of brand names of antibiotics, there aren't really that many different types. And we should actually cover that more extensively soon, Lewis.
Yeah, we definitely should. I'm sure there are plenty of experts out there who can give us all sorts of insight into that.
All right, excellent bonus show coming up today. Lewis produces and hosts the bonus show. We will talk about Zipf's law. We will talk about a women's rights activist demanding a higher female body count. What is that all about? And much more. You get the bonus show the same way that you get all supporter benefits, by going to our website, davidpakman.com, and subscribing. Become a supporter, support this program. We'll be back after this.